About CPR. When you don't have the C.P.R mask, this is what we call the C.P.R mask or the BVM. Mainly our ambulances, they move with BVM. If you don't have the PPE from mouth to mouth, you're not going to do mouth to mouth contact. Am I communicating? Please don't risk your life without the C.P.R mask to put on the casualty's mouth. Because the World Health Organization, which our body, they declared the Ebola, the COVID, so we don't no longer do mouth to mouth casualty when we have the C.P.R. Don't go to the hospital, start because I told you that you have to do mouth to mouth. This one also, it is personal. You don't share your colleague, you give this one, you give the other one. No. You have this, it is really personal. And no matter what we use the BVM. The bag, we bag 2 times. If you don't have this, you just maintain the air will open, then you maintain the chest compression. How deep do we go down when we are compressing? 2 meters. We go 2 inches, 5 to 6 centimeters down. Is it okay? How many chest compression per minute? 100 to 120 a minute. It means if you're less than 80 or 70 in a minute, it means you're very slow. Again, if you are 160, it means you're too fast. Is it okay? Yes, so we are going to do the compression. You see how we compress, how we position the casualty. So you put on your gloves. So you have 4 fingers. Fingers, so the casualty is down. We need to know what is happening. You balance the casualty. Okay. I'm going to start from assessing Dr. ABC. Here I'm going to assess up to C. Are we there? Yes. Good. So which name are we giving? James. Jovia, okay. Jovia, can you hear me? No. Jovia can't respond voice, If I inflict pain, Jovia can't respond to pain, From there, I'm going to open Jovia's what? Airway. I open the mouth, I check in the nose, Jovia's airway is clear. If the airway is parted, closed, that is now where I need to clear the what? Airway. If it's the tongue, I have to roll the casualty to the side so that the tongue can clear the what? The airway. The moment you don't clear the air, what you kill Jovia is the blocking of the airway. So clear that first, you go to another stage when it is clear. Good. Jovia's airway is now clear. I go and check for what? Breathing. LL what? LLF. I listen, I look, I feel. 10 seconds. Don't rush. Okay? And again, don't be there for the whole day. No. Use 10 seconds, get the attributes. From there, the breathing, airway is clear, but there is no breathing. But that's your colleague. Look, guys, Jovia is not breathing. I do what? Gauge. I check for what? Saturation. Count it at rate. There is no saturation, guys. Call for help. Call an ambulance. Do you have ambulance number? Yes. Who has it? You don't have. 0800 211 088. Are we together? Maybe you can give it to the bystander or to your colleague. Please call an ambulance. 0800 211 088. Talk to them, tell them, I have the casualty here. She's an adult, female, but she's not breathing. There's no breathing, there's no circulation. Call them right away. Are we there? Yes. Good. From there, you position Jovia on the flat surface. Because the heart is not now working, the lungs are not working. You don't want to allow the brain to do what? Die. Immediately you have to start CPR. So the CPR, yesterday I showed you where the heart is located. Where is it located? Where? This is the sternum what? Bone. The heart is lying on the sternum what? Bone. Okay? But just inclining on the left side. But the heart is beating. So that is why you're going to press your word. The heel, you're going to use the what? The heart. Are we there? So your hand should be straight. Position it there. Bring another hand. Lock. By locking, your hand should be straight. And you're kneeling straight. So you're going to use the energy from the shoulder. Okay? You're going to go to they're going to be 4-5 centimeters down. Or rather than 2 inches. Because you have to reach the heart. So after starting chest compression, I'm going to do mouth to mouth. Using the what? The C.P.R mask or the BPM. Okay? Good. How many chest compression? 30. So you're going to be counting, okay? Yes. Let's go. 1, 2, 3, we go.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17,
30 chest to what? Compression. Immediately after 30 chest compression, I come, I open the air. If you're going to do mouth to mouth, or if you're going to do using the BPM, make sure you open the what? The airway. If you don't open the airway, the air will not enter. So you need to open the airway, then you do mouth to mouth. Okay? But I told you I'm not going to do mouth to mouth. Because of that. So, have the C.P.R mask. Immediately connect the C.P.R mask. Prepare it very well. This one automatically will go to the other side. Okay? Then this one comes this side. So, connect to the casualty's mouth. There. Then we use what we call the C grip. The C what? Grip. The C grip. C and E grip. So this is the C, this is the E. So the C and E grip will open. This one will help you to open the airway. But this one helps you to seal off and then you open the airway. Then we blow in. Are we there? How many times? 2. 2 times. After 2 times, I go by the chest compression. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. After 30 chest compression, 2 rescue breaths. From there, then I check for what? I check for pulse. Okay? Could be the cycle I've done, this guy has started what? Saturating. No breathing, no saturation. Again, I do what? Continue. You continue until when? Shall call for an ambulance. Are we there? Shall call for an ambulance. The ambulance is coming. The ambulance is not yet here, you continue. continue doing the chest compression. The ambulance team arrive, they will come with the EMT, the emergency medical technician, will come with, because you told them, cardiac is not breathing. They come with oxygen, come with maybe IAED machine, connect with the cardiac. Okay? Then from there, when the EMT comes, hand over the EMT. But you don't stop until these guys come. You stop CPR when the cardiac has shown signs of happening. Okay? You stop CPR maybe when you're tired. Because when you get tired, you cannot live. That's why you're going to hope someone can come and go. Maybe when you get tired, someone can come, replace you, relax, someone takes over. Okay? If you don't have the CPR mask, what you're going to do, you're just going to maintain the airway. Get some bystander, come and maintaining only the airway. So you can do the chest compression. This one will be here, maintaining the airway. Now, how do we do for the infant? Normally, infants, we say infant maybe from maybe 1 year, 2 years below. Those are what? The infants. Yeah. So such babies or young ones don't use the same energy for the adults. Okay? Yes, so for such people, for these ones, you're going to position your baby to be here. Okay? Remember, on young babies, their airway is too young. Okay? So when you're opening the airway for the baby, make sure you leave it straight. Because the moment you try to tilt the head, you're blocking the airway. So they need what? Straight and support it. Then from there, you're going to use your two what? Fingers. 2 fingers, then you're going to rotate the heart. But in the babies, we first do 5 inflation. How many?
5.
How many?
5.
5 inflation. Because in the babies, what we do them first? First do the 5 inflation. Okay? Then we do 30 chest compression. Why can we get? We do how many first? 5 for the first cycle. The second cycle, go back to the 2. Okay? Go back to the 2. You open you up. Go to emergency, go to the emergency, go to either choking, go to choking, then you check if babies, or if you put babies, then you see. So we are going to break position the chest compression. We do our 30 chest compression there. After 30 chest compression, we do now our 2. Let's do mouth to mouth. Okay? Or you can put the baby on the ground. Put our baby on the ground, and you get something like a cushion or anything. You make sure you position it here, that will maintain the airway straight. Okay? Then from there we lock, then we do our chest compression, 30 chest compression. 10, 20, 30. Then 2 rescue breaths. Again, using the C.P.R mask. We have C.P.R mask for babies or for the infants, like that one. But if you don't have the other one, normally what we do, we just turn them. But this is too big. There are those ones like that one, you can fit here. turn it just like that, it, then blow in.